Wow.
So, Annalisa, why don't you tell me about what brings you in today?
Yes, hello. So I've been in an accident in February 2020, and as a result I got 2 discs in L4 and L5 bulged. One of them is really bad. The L5 is about 5 millimeters.
Okay.
The L4 is a little less, about 3 or 2.5. And I have pain in my lower back, mainly in the left side, shooting down my leg all the way down to my ankle.
Okay. Does it go down the back side of your leg or the lateral side of your leg?
Both. Back
Okay.
and then on the side right here.
Okay.
And sometimes even here. And as a result, I can't really sit for too long. I can't run. I can't really exercise other than doing swimming and some very gentle physical exercises.
Okay.
And like stretching and stuff. And it hurts even to just lay down if I don't have pillows under my legs or in the side fetal position. I need to have a pillow in the middle.
Good. So ergonomically, you know how to sleep.
Yeah.
So you're not a stomach sleeper because that's the worst position to be in.
Sometimes, but I don't. Yeah, very rarely. And if I do, I always put a pillow underneath my legs.
Okay. Okay. Because ergonomically speaking, to lay on your back with a pillow under your knees to get rid of that lordotic curve is going to be the best way to sleep. But we all can't sleep like a corpse on our back, so of course we constantly rotate. The best thing that you have found to get out of pain is just by changing your position often, or is there anything else that you do that completely helps?
Nothing really helps in terms of getting rid of the pain. It does alleviate it a bit if I stretch, if I walk a little bit, if I'm sitting for too long, and sometimes if I put a heating pad on it, that does help.
Okay.
And that's, just help though. It doesn't really get rid of.
So what we're going to do today is I'm going to bring the table upright. I'm going to bring you down. I'm going to check your leg length. I'm going to palpate your body by manually seeing what kind of mobility we have. Okay, I'm going to start down below. And what I'm noticing is your left leg is longer than your right.
Okay.
Have you heard that before?
Never. No.
Okay. Now I am going to palpate, putting a little motion into, this is called your SI joint. It's where your sacrum and your ilium meet. So I'm going to put motion on the left side. Does this cause any pain or discomfort?
A little bit.
And I'm going to do the right side. Same?
That's fine, the right side.
Okay. So putting a little pressure on the left, did that ignite that pain going down your leg? At all?
Not really. More in my lower back.
Okay, just more generally speaking here.
Yes.
Okay. Now I'm going to touch your L5. And it's come to your left. Is it a little more tender here than it is on this side?
Yeah.
Okay. And this is your L4. Is this one tender as well?
Yeah, and it also hurts when you touch it.
Okay. Both of them or more the L4?
Both of them,
Okay.
on the left side.
And this is L3. Is this one tender?
Not really.
And 2.
No, it's fine.
Okay.
I'm sure you've all heard the term subluxation. What that basically is, generally speaking, is chiropractors use that term to describe a spinal vertebra that is out of place. So it's not a dislocation, it's a subluxation.
Now I'm going to work my way up your back. Okay. And you have some tightness there as well. All right. So now, this has been going on for some time. Do you mind if I expose your skin?
No problem.
Okay. I'm going to slide this down just a little bit. So I'm going to go right in here. Do you have any muscle that feels tense on this side as I palpate around? Versus this side. So the musculature you don't feel is grabbing, it's just that L5 and L4 are out of place. Okay, but you don't have any tenderness when I do this?
A little bit, yeah.
Okay. So are you familiar with Graston Technique, which is a tool, and it sounds horrible, but it scrapes the skin, breaking up muscle adhesions, knots, fibrous and scar tissue?
No, never heard of it.
Okay, so you might have some discoloration when I do this work on you. Are you okay with that?
Yeah.
Okay. And have you ever had cupping done before either?
I have.
Okay. So we're going to do that today. All right. So I'm going to use some oil. So what I would like to do, our goal is to break up some of this fibrous tissue that surrounds this area, so when we do the adjustment can hold longer.
Perfect.
Okay.
Thank you.
Yes. Okay. So I'm using a tool. It's called a gua sha tool. It's jade, and I'm just going to use this right in this area. And what I'm looking for is scar tissue, fibrous tissue, and this way the Graston technique is to break that up. Is this uncomfortable at all?
A little bit of pain, but it's tolerable.
Okay. If it's too much, let me know.
Alright.
And you'll find that you will have some discoloration. We're getting blood flow through the muscles to help the muscles function better. I'm glad you're a swimmer. That's the best thing you could do for anything with pain, you know?
Yeah.
You don't have gravity pushing you down.
Yeah.
We're not getting a whole lot of discoloration. And so predominantly it's all on the left, or you feel tension on the right ever?
Always on the left.
Okay.
Yeah.
All right. We'll kind of break you in, and we won't do too much. But this is something where it will be a little tender for a few days, but you will feel more relief in your functionality and mobility.
Sounds great.
Yes.
Thank you.
All right. So I'm going to do a little bit of cupping. And I'm going to do more of the mild cupping with the silicone cups versus more aggressive. So as you know, cupping is a suction. It will pull any inflammation, especially since we broke up some old scar tissue. I didn't do it for so long today because we're going to break you into this technique. And this will just help pull out any of that inflammation, creating more redness to the surface.
All right.
Okay. So then our goal is to, when I bring you up, I'm going to have you lay on your left side. That way I'm going to pull your L4, L5 spinous process vertebra back center.
Got it.
Because that is what your body is telling us it needs, the way everything's dysfunctioned.
I will, thank you.
You're welcome. How does this feel? Okay?
Good.
Okay, so as we know, all the other vertebrae surrounding that area of your L4, L5, if these are out of place, we can create more dysfunction down below. So that's why we adjust the whole body, okay? If you'd like to put your hands to the floor, just have them relax. So I'm going to work my way down your spine and let you know what I find. This is the first vertebra right here. I'm going to ask you, is your chin hitting metal at all?
No.
Okay, I'm going to ask you to take a breath in and release it. I think my table creaked just as much as you did. Okay.
It does feel tender in that area.
In here or
Yeah.
up there? In here.
Yeah.
Okay, yeah, that's where I'm finding. So I'm going to ask you to breathe in again and exhale. You okay? All right. And lastly, I'm going to have you bend your knees. This time, I'm going to ask you to take a breath in and hold your breath. So go ahead and breathe in, hold, and down. All right. Okay, so your sacrum is posterior on the right as well. So I'm going to let you know what your body is looking like on the model.
Perfect.
I'm going to bring you upright. Your sacrum on the right is posterior, and your L5 and 4, so I'm making this look a little more obvious, has moved to the left.
Yeah.
So my goal right now is to push that sacrum in and pull L4 and L5 over. But we'll just kind of keep that there for right now.
All right, so that's you.
All right.
There are 3 general types of stresses that can cause subluxations to occur in the body. Number 1 is a physical stress. A physical stress would be something similar to a disc bulge that a person has, a scoliosis, which cause tight muscles, and those would be physical stresses. Second one would be a trauma. A trauma would be a sudden slip and fall that causes a whiplash type of injury or low back spasm. And lastly, the most common one that I see in my practice would be repetitive stress. Repetitive stress can be caused by workplace injuries. Somebody who is working from home now and decides to set up a station at the kitchen table, and that would be repetitive stress.
I'm going to start with you on your right side first with your left up, but all the work is going to be done the other direction.
Okay.
So go ahead and lay this direction towards me. Your bottom leg will remain straight, the top one bent. Good. I'm going to take this shoulder, pull that out. I'm going to pull your pelvis a little more central here. This way your knee will fall off the table. Good. And I'm going to have you take a breath in, look towards the hallway, and breathe out. Good. Wow, that was a lot.
A lot.
We're going to do the other side. So your bottom leg is straight. Good. I'm going to slide you a little more central. I'm going to roll you a little deeper, and we're going to get the sacrum in. So you're not going to fall off the table, but it's a deeper move.
Got it.
So look behind you and breathe out. Now I'm going to specifically get the L4 and 5. There we go. All right, feel that rotation.
Yeah.
Let's have you go on your back. Good. All right. Excuse my reach.
No problem.
Okay. Look and even. Good. Do you have any pain or discomfort in your low back right now? Little bit?
The usual.
Okay. Then why don't we bend your knees? This will help flatten out that lordotic curve.
Yeah.
I'm going to release your shoulder blades and go from there. So I'm going to place my hand underneath your scapula. And this one is going to come up and just couple gently behind your neck, but don't hold on. And that's it. Are you okay?
That was very quick.
Yes. So this adjustment is to get your scapula adhered back to your rib cage so it doesn't wing.
Oh, okay.
A lot of people who are on the computer or standing, we tend to come forward. We'll have some winging in our scapula. This helps with that.
Great.
Okay, and this is going to go right here. Good. All right, that one was not as crunchy. Okay, and lastly, we are going to look at your neck. How are you feeling?
A bit better, I have to say. It's it feels like there's less tension and less pain too.
Good.
Yeah.
So lots of water today. Anytime you've had chiropractic or you worked out, you want to help flush your muscles with water. All right, I'm feeling right here.
Yeah. Yeah, it does feel tender right there.
So always where the lower cervicals meet the upper thoracics. That's a point that we tend to all have out of place at times. Okay, so I'm going to just start with a couple different things of flushing out your muscles. And then I'm going to do a couple stretches. Do you have any pain?
A little bit. I've always been prone to having quite a bit of tension in my shoulders.
Okay, just breaking up those muscle adhesions in there. Okay. Or do a circle one direction and then the other direction. You're loosening up all of those small little muscles in the spine. So that will be another good thing to start to implement when you go to bed at night and first thing in the morning. Okay?
Got it. Yeah.
So I'm going to go ahead and I'm going to adjust our C5 that has come again to your left.
Yeah.
Yeah, everything's on your left.
Yeah, I'm also left-handed.
That makes sense. Okay. So I'm going to place them right here. I'm going to ask you to just relax your head. Let it be heavy. Ask you to just that's it. Specific and to the point.
Didn't hurt at all.
Good. That definitely wanted to go back in. All right, and the last one is right here on the right. Okay. So just relax and breathe. Can you snap your fingers on your left hand?
Wow.
Okay. Go ahead and straighten your legs. What I wanted to see with you is put your right hand up and with your left hand grab your thumb and bring your thumb to your forearm. So flex it forward. How close can you get your thumb? Nope, this way. How close can you push your thumb to your forearm? So you're pretty close, yeah?
Yeah.
So this is how close I am.
Oh.
So show Sam. That means you're more flexible than most.
Oh, okay.
So when you're hyper flexible than most, can shift in and out easier, which is not a good thing. And isometric exercises are going to be your friend.
Okay.
Not per se yoga so much, even though you'll probably be very good at yoga.
Got it.
Yes. I'm going to bring you up, right? And let's see how you feel with full gravity. And have you walk around. You tender, you feel okay?
I feel a lot more, less tension, a lot more just openness and mobility. The pain as well seems to have, it seems like it's less on my lower back going down my left leg. It's definitely less.
Good. So
I feel better.
All right, good. Well, lots of water, and we'll see you next week if you're available.
Thank you so much.
You're welcome.